Okay. Hi, my name is Peter Walker. I'm the advocate for the voluntary sector on the Health and Wellbeing Board. This is just a brief update from the meeting of the board held on April the 2nd. As people would know probably from previous reports back, the board considers a lot of overarching matters, and amongst those the key one on this meeting was around social isolation. And there's obviously a huge initiative with the Lottery Fund under the Ageing Better initiative in Bristol, and there was a number of presentations in connection with that at the board meeting. This clearly is a key issue for the council and health, and we can expect to see a lot more activity on this front, both from the sort of commissioning that's going to come out from Ageing Better funding in Bristol, but also I think from the council as time goes by. Moving on, there was of key interest, I suppose, to some organisations as a result of the new Care Act, is that the Safeguarding Adults board is now having a Safeguarding Adults board is now a statutory responsibility, and that has to provide an annual report to the Health and Wellbeing Board, which indeed happened on this occasion. People may be interested to know that there were over almost 3,500 alerts reported to the board in 14-15, of which some 682 went on to be further analysed. And one of the main areas of concern raised in these alerts was physical abuse of people. So this is something to watch, and it's clearly got the status now of the Children Safeguarding Boards, and again reflects the increase in priority given to the protection of vulnerable adults. So moving on, there's going to be a recommissioning of care homes in Bristol, maybe not of major interest to a lot of voluntary sector groups, but some will be involved in the provision of care homes, and the council is going to like to move away from the swap purchasing it currently undertakes to a number of more defined bespoke block purchase contracts. So that's going to happen in the future. Again, general population will be interested to know that there's been improvements around health protection, and this is about the system set up in the city to cope with the issues affecting the health of the population generally, which could be connected with outbreaks of disease, such as, and they had an exercise around Ebola, which they were successful in carrying out this exercise, which would be, I suppose, if there was an outbreak of Ebola in the city caused by someone coming in, then we can all be reassured that the city is well prepared to cope with such things. Similarly, there was also an MMR catch-up campaign, again looking at general health protection issues in the city. The alcohol strategy, again at the last but one meeting, there's been a big discussion around the importance of managing alcohol as a health issue in the city, and the Health and Wellbeing Board believes it can provide added value to the whole debate around alcohol. And to do that, it's got a summit meeting that's been called on July the 16th this year, where a number of key parties from all the different agencies involved in managing issues related to alcohol will be brought together to look at what can be done to improve the response of the city to health issues and other issues related to alcohol. So that's an important piece of work, and we'll see how that develops. It's likely to go on for some while, but I think this is a really interesting and exciting initiative by the board. That's it mainly for that meeting. Just to say, this will be my last feedback from the Health and Wellbeing Board. I'm resigning from the board, and there will be elections organised by VOSCA to replace me. I found it a very interesting opportunity representing the sector on the board. There are high-level issues involved, but I think it is an opportunity to experience being part of a council committee and dealing with issues of a fairly fundamental and strategic nature in Bristol around issues relating to health and social care. So I wish good luck to my successor, and just to say the next meeting of the board is on June the 17th.